All right, so naltrexone, also known as Revia, it's actually, as a lot of people have noticed in the show Painkillers, they talk about opiates, right? There was a whole opiate epidemic, and there's still tricklings here and there, but it's almost like people would just prescribe opiates all the time. And now there's like this strong correction where like nobody will prescribe opiates. But that's where the illegal kind of industries out there with fentanyl and carfentanil and heroin. And so there is a medicine that blocks opiate. It's called naltrexone. So it's an opiate receptor antagonist. It actually helps with alcohol dependence because when you drink alcohol, you do release an opiate to your brain. That's where you get the pleasure from. So if you don't get a lot of pleasure and you're drinking, and you probably don't want to drink very much. So it's used in conditions for alcohol dependence, blocks exogenous opiates, right? Like heroin or oxycodone. It's used in prevention of relapse opiate dependence. So that compound is actually found in Suboxone, right? So what happens with Suboxone, is it is an opiate, but if you try to inject it, it literally gives you naltrexone, the opposite of an opiate. So some side effects, you could augment with a camperset, as we kind of talked about, behavioral, educational, and supportive therapy. You would need to do urine drug screens to make sure people aren't misusing opiates higher than what naltrexone can block. Side effects are nausea, vomiting, decreased appetite, dizziness, feeling a little bit down, having some anxiety. It can affect your liver. So again, you start off at 50 milligrams a day and slowly build yourself up. It's not used in children, not recommended in pregnancy. And it is a good option. The problem is not available in an injection, not available in a solution. So again, like other aversive medicines like dalsulfiram, if you don't take it, you don't really feel much of a benefit. But it is a helpful way for someone to